Men Only, a podcast for men, about men. What do men want to talk about? In this Men Only podcast, Better Than Drugs, we discuss the positive benefits of exercise. A landmark, world-first study on bowel cancer presented to the American Society of Clinical Oncology's annual general meeting in Chicago concluded the benefits of exercise for patients who had already had treatment for the disease, saw their risk of death cut by more than a third, just by taking up an exercise programme. In this episode, we explore the importance of fitness and nutrition to achieve a healthier, fitter future. To discuss this exciting development and social prescribing by doctors, I am joined by Dr James Morton, GP, author and baker, who rose to fame as the worthy runner-up in the Great British Bake Off, and personal trainer Chris McKenzie. If you want to achieve a healthier future, not just to get fit for the six-pack on the beach, watch the podcast, which includes a gym and home workout, to encourage those first steps to a healthier future. Let me know how you get on. Drop me a line on the Men Only website, or tell me what topics you want to discuss. Men Only is produced as a podcast for men, about men, and what men want to talk about. I hope you enjoy this episode. I'm delighted to welcome to the Men Only podcast Dr James Morton and Christopher McKenzie for our discussion today about improving your health and how to achieve it. James, you're a Glasgow GP, an author and a baker. You created some fabulous sweet treats when you participated in the Great British Bake Off, and you didn't bring many. I'm so upset. However, we're here today to discuss your current role with Healthcare Improvement Scotland, which issues advice to NHS treatments to doctors on recent medical research. Overprescribing is costing the health service 300 million in waste in the UK each year. James, can you tell us exactly what is meant by social prescribing and how this will improve the health of patients?
Brilliant. No, thanks. That's a lovely introduction. Thanks for having me.
I was really hoping for a cake.
I'm sorry. Yeah, it's a busy time.
This is about men's health and fitness, right?
Yeah.
I thought I'd get in there quick.
Sweet treats are important as well. First and foremost, I'm a GP. Obviously, a gigging GP in Glasgow, south side of Glasgow. But yes, I also have this role within an organisation called SIGN, which is the Scottish Intercollegiate Guidelines Network. We look at guidelines and how healthcare providers of all kinds, GPs, hospital doctors, nurses, allied health professionals, if they're needing up-to-date evidence and to make good decisions, then SIGN provide these guidelines. Right. And so that's the role I've got within Healthcare Improvement Scotland as the vice chair of the council there. And one of the things that I'm really interested in is actually healthcare's impact on the environment, on sustainable healthcare. Healthcare is hugely damaging in terms of pollution, both direct pollution and in terms of its contribution to climate change.
Sure.
And actually the impact that we can have as healthcare professionals, if we can encourage a healthier way to live, we can massively reduce the need for healthcare, hopefully, and have all these other benefits and all the co-benefits as well about making people feel better.
Yeah.
So while medicines are incredibly helpful in many ways, they are life-saving things, often there's an alternative. So it might be on a practical basis. That means if someone's coming to talk to me about their overall cardiovascular risk of heart attacks and strokes, things like that. We're talking about all big things like blood pressure and cholesterol. It's really important to have that talk about actually probably what makes more of a difference, which is things like activity and diet. So social prescribing, to come back to your original question, is about empowering people to be able to within their within their own personal circumstances to do things to make themselves healthier.
Right.
And that's going to be very different depending on where you are in the country. My mum's actually a nearly retired GP in Shetland.
Oh, right.
So
Shetland.
Yeah. So she might very much socially prescribe something applicable to the surroundings, you know, hill walking, or getting outdoors, all these kind of things. Whereas in Glasgow, you know, where in the East End, where we are right now, that might be a bit more
challenging.
Challenging, yeah. So we've got to look at what's available. And actually, that's a brilliant thing about how general practice is set up, because we're all sort of in these little centres around in the communities. Yeah, exactly.
To the area. Chris, I'm going to ask you, you're a professional trainer. Want to talk to me a bit about what that means?
It just means that I have an opportunity to come alongside people on their fitness journey and kind of guide them and help them achieve their fitness goals and their health goals. Everyone's are different.
Yeah.
But yeah, it just means that I'm basically a coach.
Yeah. So basically, I mean, I know you quite well. You've got a diversity of clients from very young to very old. From your experience, what do you think works for your clients to achieve those fitness goals?
There's always a few things. We've spoken before about how fitness and exercise and training is as much mental as it is physical.
Yeah.
It's one of my challenges is to keep people engaged and not wanting to give up or quit. And probably the most effective way that I've seen is to find the training style that they like, that they're not going to get bored of, that does help them achieve those goals. It requires a lot of creativity. I like to keep sessions very, very different, whether it's strength and resistance training or whether it's more HIIT training, cardiovascular, you know, improving people's conditioning. I try to keep every session different because you never get bored. And I do find, I mean, just as observing in the gym, you know, I've been in one gym right now for 3 years. So I've obviously seen the same people come in. And for 3 years, I see them doing the exact same thing and the exact same thing. And I don't necessarily see results. And what happens is your body gets accustomed to what you're doing and it just sort of stops responding if all you do is run on the treadmill and do a few bench press and things like that. So I try to keep it really, really diverse. I think one of the things that I kind of categorize it as or label it as is keep the body off balance. Don't ever let it get used to what it's doing. So that's why when you and I train, sometimes it's slower, more methodical, more resistance training, more strength based, and then we'll also do something that's really up tempo, cardio based. And what I also love to do is bring some of the resistance training, resistance moves like deadlifts and squats and things like that into a more cardio style. So we'll keep the weights lower, but we'll do way higher reps or something like that. And even the people who like to just do weight training find themselves getting in better shape doing the kind of lifts that they like rather than battle ropes or rowing or things like that might not really be up their street.
So what do you think about that, James? Have you had a go at the gym?
Yes, indeed. I wish I had more time, I suppose, to go to the gym. But I'm very lucky to have a very good pal who's actually, he lives around the corner. He has a gym in his basement. So I go round to his, he calls it the training room, and he coaches me. He's an ex-Scotland international rugby player, so he's very good. But I tend to be sympathising with you. I tend to actually focus on resistance training. I follow a slightly strange Texan group called Starting Strength, who provides sort of barbell exercise, resistant exercises, which is very good for beginners. And I will consider myself, despite having done it for several years, a beginner, very much so. And I really enjoy the resistance training, but gradually improving over time. Which would be really interested to get Chris's take on as well. I think he always refers to it as like medicine, you know, as
absolutely,
which I think is quite good.
Exercise is medicine.
I think once you sort of get that into your mind that's what it is, like, you're almost like trying to future-proof.
Absolutely.
What your body's going to be like.
And it's something that I more and more evangelise about in the surgery. And not to your typical demographic. I'm not talking to, apart from if I'm trying to just get someone engaged with exercise for the first time who has had very bad experiences, bad associations, say, with cardiovascular exercise at school, say, not ever feeling themselves as fit, then actually going down a resistance route can be really good, empowering, and get them on a track from the beginning. So that would be one group of people. But the other group of people that I have to talk to about strength training is your more elderly demographic in terms of preventing frailty. and what some people like to call the compression of morbidity. Not necessarily extending how long people live, but while we're all here on this earth, living actively and as well as possible. So that's what I tend to end up talking about in the surgery. And often, getting into one form of exercise, as you'll see, leads to more of a, definition or more of a motivation that leads you to feel that that's something you want to do. I find it's really, really helpful to talk about this, as a personal GP, when people are coming in to ask about their health.
Yeah, I mean, I think what I found quite interesting, because we've talked about it a lot, is that there was an event by the annual American Society of Clinical Oncology in Chicago, and they had a session called As Good as a Drug, and it was presenting the results of a decade-long research on bowel cancer. Now, it was what I found really amazing about this, it had quite a big impact. It was the first time there was clear evidence that exercise was better at preventing cancer recurrence and death than many of the prescribed drugs. It also, and something that I'm really interested in, obviously, was it also helped lower the risk of cancer such as prostate and breast cancer, which is obviously gets quite a lot, prostate cancer in particular gets a lot of publicity at the moment. I think what they did was quite interesting. They had one group that was offered fortnightly sessions with a PT for the first 6 months, and another group was just given leaflets. And the results were amazing. After 5 years exercising every day, 28% less likely to have died. After 8 years, 37% lower.
Wow.
And then for every 14 participants who exercised, one was prevented from dying. I think that's quite a good persuasive argument to get people into exercise, because we've got 44,000 Britons diagnosed with bowel cancer each year. Do you think, James, it would be possible to be able to prescribe PTs as an option in the future?
So this is really interesting. This is not evidence or a study that I've seen myself, but it sounds very compelling and actually would fit with the fact that I'm thinking about the guidelines that we produce, or that Healthcare Improvement Scotland and SIGN produce. Exercise is mentioned in almost all of them. As a way to prevent illness, okay? And if you think about it, there's a big Scottish Government initiative just now on prevention of cardiovascular disease especially, and physical activity is just massive. Now, obviously, in terms of, it's important to differentiate there between cancer treatment and cancer prevention. No one's going to say that exercise is going to treat things, although can give you all the holistic extra happiness effects that exercise can give. But in terms of prevention of illness, if you look at the association with so many different cancers and obesity, for example, it's massive, absolutely massive. And it's a huge problem in Scotland that we need to tackle. And actually, I suppose, being where we are, for people at home, we're filming this in one of the most deprived parts of the city, interestingly, and PT, absolutely brilliant if you can afford it. I'd be really interested to get Chris's take on how we could basically create opportunity for everyone who can't afford PT, who potentially can't get to a gym. How do we open this up to all communities in Scotland? How do you think?
I mean, I've not given it a lot of thought. I think that accessibility obviously has to become a lot better for people to have access to PTs. To at least, I mean, obviously the evolution of online. People now, I know a lot of people bring in their phones and I see them looking down and they're following along something. You can do that in your home. You can do that. You can pick ones that are equipment free, like you do body weight, calisthenics, plyometrics, things like this that you can just do in your home. You might buy a couple of pieces of kit, like a kettlebell and some resistance bands and things like that. And there's going to be something available for everyone to find like that. When she was mentioning this, when you were bringing this up, Jackie, and I was thinking, well, when people go feeling depressed or anxious or something, they're referred to a councillor. I'm not really sure why that couldn't be something that they're referred to a PT in a similar way.
Because see, when they did their study, what they obviously did a costing on it as well. And they said the estimated price was 2,000 to 3,000 per patient for 3 years of health coaching, and it works out cheaper than drugs and without the side effects of toxicity. Wow. So they've done a sort of financial analysis of it and thought this is and plus, if you continue to do that throughout your life, if you think about all the potential other illnesses you could have because you're unfit, because you're overweight, it does seem to be a good cost-effective argument.
If you have a long view, right? If you have a long view, it seems like it would.
Yeah, for a long. It's a long game.
The government to think. In the future, we'll have far fewer things to treat, far fewer people to admit, if we have a healthier population.
Yeah.
So it makes sense to, as you said earlier, future-proof a society by really kind of working it into.
I'm all about the long game. I'll be dealing with my patients that I'm seeing just now, hopefully for the next 30 or 40 years before I retire. It'll be a good wee while. Yeah. So I'm very much always keen, and I'll be very keen for, to see that health economic analysis, to see whether there's where the compelling argument is. And if it's there, then I will always shout for that. It's what we really need is this fairly big societal change to remove or to improve on the various problems that we've got that are leading to obesity and sedentary lifestyles. It's just really, really hard to tackle. Yeah,
and I think, as you were sort of saying, cost can be a big issue for many people, but if it became an option where doctors could actually prescribe, you can see this PT or whatever, and there's definitely, obviously, they've done the sums in this, this analysis. It seems to be it's a no-brainer. Because it's, can you think about £2,000 or £3,000 over 3 years as peanuts when you consider the cost of some drugs? Yeah. I wanted to go on and maybe discuss, James, about problematic polypharmacy.
Oh, yeah. Subject close to my heart, if you can say it.
Just to know what? I did practice several times. Could you explain what that is and what you would encourage those in medication to do?
So, this is a really big problem, for some people. And it reflects the fact that there's lots and lots of evidence that say lots of individual drugs are very good. They work for certain conditions.
Sure.
And that can lead us as doctors to add in drugs, add in medicines. So someone comes with a new problem, a new medicine for that, because we know that this medicine works. And then gradually, quite quickly, in the scale of things, over a few years, you can suddenly find yourself on 7, 8, 9, 10, some of our patients, 15, 16 medicines. And my messaging on this is really quite simple. It's just to try and know what you're on and to know why you're on it. And if you don't know why you're on a medicine, find out. Okay. The community pharmacies are brilliant for that. So the community pharmacist that dispenses your medicines on a monthly or 2 monthly basis will be able to give you lots of information on that. And if you're on it for a problem that isn't there anymore, then stop it. Because medicines are not just expensive; they can have side effects. They can be harmful over the longer period. Yeah. It's particularly true about things like medicines for, say, chronic pain, for example, that can stack up. And if things then improve, don't just stay on the medicines. Have a rational chat with your doctor, practice pharmacist, nurse, whoever's set up in your local area to talk about it.
Because sometimes if you can get two medicines, one can negate the other if they're taken at the same time. I've been reading.
So certain ones can have counter effects, certain ones can interact. Hopefully, as we prescribe, that becomes apparent. But the thing is, when medicine, and sorry if this is alienating to anyone, but when medicines are studied, they tend to be studied in a fairly controlled manner. Right. Yes, on thousands and thousands of people in trials, but on people with relatively few things wrong with them often, or with not on too many other medicines. And then it's sometimes only when the medicines are licensed and prescribed on a much larger scale that we start to see sometimes some little teething problems. And that can be interactions that we don't know about. Okay, there's a brilliant scheme in the UK called the Yellow Card Scheme.
That's right,
run by the MHRA. So anyone can, if you get a side effect from a medicine, whether prescribed on the NHS or privately, because there's a lot of that happening just now, you can report that side effect, especially if it's not listed in the literature. Or, if there's medicines interactions, and often if you're on 8-10 medicines, we don't know about the interactions that are going on there. We're having to act in best interest. So sometimes if we're seeing a patient who's having problems that we can't quite explain, cutting back on medicines can be a really useful tactic for us doctors.
Yeah. So you would probably recommend to people to keep an eye on their medication if they've got side effects to flag it up.
Absolutely.
Yeah.
Generally, making rash choices and stopping things without speaking to anyone isn't a great idea. Speak to someone. Well, some things, but I would certainly speak to a pharmacist, speak to your practice pharmacist or a GP. You might find that your practice pharmacist, if your practice is lucky enough to have one, will have they'll have appointments.
When I was reading about this, they were saying it was older people were particularly at risk because it can lead to sort of dizziness and confusion. Is that true? Yeah.
Certain medicines, and this is absolutely, we mustn't tar medicines all with the same brush, and there's certain medicines that mustn't be stopped suddenly, so it's always worth checking with someone before doing anything. But dizziness, unsteadiness, memory problems, again, certain pain medicines, certain antidepressants, anti-epileptic medicines used longer term, if not checked up on, can cause problems as you get older. But many of them can also be life-changingly beneficial. So it's one of the, it's a balance. So that's why it's important to have those conversations. And we're very lucky, very much pushed by the Chief Medical Officer in Scotland to have something called realistic medicine, which is about having sensible conversations with between a healthcare provider and a patient to come to a shared decision about ongoing care. Those realistic conversations. So by all means, that is not lots of people. One of the big problems we have got in general practice is actually people not coming to the doctor. There's a perception that you can't get an appointment. It's difficult, and often people are feeling that they don't want to bother us, which is a shame, because actually there are certain things like that, like discussions like that it's actually really important to have. So by all means, do phone up and get that appointment. Because what I've been reading with the sort of like older people, and sometimes the drug combinations can lead to falls and hip fractures. Now, when we were talking earlier on about it was like 300 million wasted in prescribed medication, hip fractures cost the NHS 1 billion annually. So that's definitely, Chris, I'm going to go over to you here. I know, like we would say, like from the 30s onwards, we do lose bone and muscle mass. Obviously, with something like hip fractures, it's always quite a severe thing to happen to an elderly person. But surely, leading up to that, if you could get the right strength training exercises, what would you recommend? When it comes to like improving bone density, I know you can get medication for it, but from an exercise perspective, what would you think would be the best way forward? Well,
we've already talked about the value or the importance of strength training. As I've aged, I've seen the value in that in my own training. As I've aged, my clientele has aged. And you mentioned I have clients across the spectrum in age, but a lot of, I think, older, more mature clients might gravitate towards an older, more mature PT because they think you're probably
good to understand exactly what I feel like.
So strength training is a big one. I have said on occasion, hips are life. Very, very important for us to keep hip mobility, hip strength, so we'll be doing hip thrusts, and I love doing kettlebell swings and things that keep the hips moving and active. We also do a lot of balance work. Balance is huge as we age. So doing single leg isolated movements, lunges and Bulgarian split squats and things like this that keep you having all of those balance, those kind of those muscles engaged, that'll help. But I mean, as we get older, I think I have found strength training is more important as we age than it was when we were younger. I think when we're younger, we think about how we look. As we age, we think about how we function.
Exactly.
And so I like to think of the way that I train a lot of my more mature clients is functional. Lots of functional movements. Because
there was, James, I know like bone density scans are quite expensive bits of equipment, and only like clinics can facilitate that. there was another trial that I've read about from a Professor Quasar, and his study stated it was like he got people to lift a 5 kilogram weight, 11 pounds, say, and the test was based on 51,000 people, 15 countries. Now, the conclusion of that was that those people that reported difficulty lifting a weight were significantly higher risk of experiencing a lower quality of life, and it could be over what they said, a quite wide range of things, like the hip fractures, high cholesterol, joint disorders, high rates of depression. And they also mentioned Alzheimer's as well.
Okay.
I always think that's a big one, isn't it? So what he's actually stated, saying it was a valuable indication of overall health and potential future for health challenges. And it was noted that the risks were higher in men. Now, I don't know why that would be, James. Do you think men are more reluctant to go to ignore maybe physical problems? What's your experience?
Well, no, my experience, and I think the evidence would back this up, is that rates of osteoporosis and frailty are much higher in women.
Right.
Generally, they stand to benefit most from, say, for example, if you look at our SIGN osteoporosis guideline, strength training is recommended to prevent osteoporosis, as well as, and again, we were talking before the podcast started about differences in causation versus correlation, and it's really difficult with some of the things that you mentioned, some of those factors, whether these are causative factors or whether they are because of associative factors. Are people who are less active more likely to be isolated, for example, that are less likely to eat well, get less sunlight.
Of course,
for
in
example,
Scotland, that's an issue, obviously.
So lots and lots of extra factors there that are really difficult to account for, and I suppose that's why in my role and in our organisation's role, that's what we're looking to do, is make sense of the evidence as much as possible, and that's why we produce these very high quality guidelines. Now, in terms of some of those things in particular, what people can do here, absolutely. In Scotland, we should pretty much all be taking vitamin D. It's pretty much the only vitamin that I, on a daily basis, recommend to people, especially if you're not getting out the house much as you get older. Really important. And then to know your risk of osteoporosis, for example, and that can be to do with the medicines you've taken in the past, your weight, gender, obviously. It can be to do with if you've had a fracture in the past, especially in your later years, then absolutely it's worth having a conversation with someone about those risks. And DEXA scans, these scans in Glasgow are waiting lists about a year for them at the minute. But they are useful in terms of that diagnosis. They're the gold standard. Okay. And absolutely, yes, we can get people onto medicines that do help, but the other factors in terms of weight, diet, and exercise, particularly resistance training, it can make a massive difference and can lead to, I have personally seen reversal of reversal, so in inverted commas, of osteoporosis on paper, thanks to these kind of interventions. So
do you think it's probably the earlier you start to think about this, the better it is for you in the long term? Say if somebody comes to you with osteoporosis, how long did you think it would take them maybe to sort of like build more muscle density through medicine, say?
It's very variable and difficult to say, and equally that we only, personally in general practice, we would only rescan people every 3 to 5 years usually. So it's difficult to say exactly. But we know that the adaptation from these socially prescribed things that we can give can happen relatively quickly. And potentially the idea of treating this is to prevent things like hip fractures, wrist fractures, things that can really impact your mobility, as well as all the other. It's
really what you were talking about, Chris. You're really talking about sustainability and the mobility as you get older. Because I was sort of reading in Age UK, fear of falling topped the list of concerns of 4.3 million people. So it's obviously a big concern for people. And And I think if that was more socially available and if it was talked about more, I think people would be maybe not automatically think they should exercise because they feel too old or they can't do it. Whereas there is always something that you can do, I think.
As Chris says, it gets more important as you get older. To do this kind of work.
Great. We're all in agreement.
Easy.
Easy. So, Chris, if you were to, can you just explain a wee bit more? Well, obviously, we know a lot about the different tips for the gym. Explain what different things, like if you're going to do weight training, what exactly you would do, how long you would do it for. Just to give people an idea that there is that thing about going into a gym that some people might think is a bit intimidating.
Sure. That
everybody's going to be young and gorgeous. Trust me, I've been there. They're not. I'm living proof. And there's no harm in building up a sweat. So, Chris, how would you sort of not so much sell it to somebody, but persuade somebody that it isn't all going to be, dreadful? I think sometimes I'm a mental block and.
People obviously have perceptions of what either gym culture is like or what training is going to be like. Sometimes they underestimate maybe the cost, and they think all I need to do is get a cool workout outfit and show up consistently and get on the treadmill or something. It obviously depends on their goals.
Right.
So how I would sell something would be, I would first have that conversation about what are we looking to achieve here. If, a lot of younger clients that may be more driven by aesthetics, they're going to want to add some muscle, they're going to want to add some definition, and we would build a program around that. But it is about kind of each individual client and what they want to achieve. And then I go about identifying the kinds of things that they don't want to do, the kind of things that they do want to do, and build the program around that. I think a lot of training, we've already said this, is mental. I think there's reasons that people stick to it and there's reasons that people quit. And it comes down to things like unrealistic expectations. They don't realize how difficult it is to achieve. One of the more common things that I'll get from a woman is, I don't want to bulk. I don't want to bulk up. I don't want to add muscle. And I'm like, there are young men in here who have been training for 6 years trying to bulk. It's one of the most difficult things to do. You're not going to bulk, And so, a lot of that is just managing expectations and helping them understand what it is that they are going to be experiencing, and really make it comfortable and make it fun. I mean, I think training isn't always fun. I get through some of these complexes, or I get in the middle of them and think, what am I doing? But what's fun about it is, one, when it's over and you feel great and you've achieved it. I mean, sometimes when I'm training you, I'm wondering, are you going to die here, or are you even enjoying it? Are you enjoying it? And at the end of it, man, I get the biggest high five, and she's just saying, that was great. And I know there are people in the gym who have seen me train you who have specifically not picked me because of how hard you're working. But I think a lot of it is, like, I'll just go back to that, just kind of helping people manage expectations and kind of understand that it's probably not as scary as you think.
I think the thing about the gym, I mean, I train with my friend Jane at the weekends, and you were sort of saying you've got your friends as well. I think there can be that social element that also helps. You begin to recognise people that is another community, and there's that whole thing about social isolation as well and mental health. I think there's so many pluses to it. So I definitely recommend anybody to get into the gym. There was something that I finally have to speak about because it's been driving me a bit crazy. I seem to pick up the paper every day and get conflicting opinions, James, so you're going to have to put me right on this one. Right. We're going to talk about weight loss drugs. Right. Now, according to the stats that I've looked at, 60% of adults and a third of children and adolescents around the world would be overweight or obese by 2050. 2/3 of adults are classed as overweight in Scotland, highest figure in the UK nations. Obesity is ranked as the leading cause of illness and linked to 23% of all deaths. Now, James, Scotland is currently spending per month 847k on weight loss pens, and that's only for about 10,000 people. Is mass medication the best way forward to treat obesity? Or again, it's like conflicting stories I keep reading. Should we take heed of what was the first death in the UK of the Scottish nurse Susan McGowan? Now, she suffered from massive organ failure, septic shock and pancreatitis after only 2 injections of Munjaro. Especially their concerns about now, because, we're talking about the yellow card system. They've been sort of saying that if you've got concerns or patients that have got pancreatitis as a recognised side effect, they've already had 560 reports. Yeah. So where do you go from that? Like, you can see the point of weight loss drugs that can help people that are really obese as a starting on a journey. Yeah. But is it something that you shouldn't depend on? Yeah, no, first I'd say my heart goes out to that patient's family. That sounds awful. It's not a case I know about, but it sounds pretty dreadful. Pancreatitis is a known side effect of certain these drugs. And it can be, as you've said, a life-threatening condition. So these aren't medicines to be just taken lightly, okay? Having said that, in appropriate circumstances, they are recommended. Now, it'll be gradually rolled out through the weight management services within Scotland. There's a brand new guideline that we've just had out on the prevention and remission of diabetes, where it talks about these because it was originally it was semaglutide, wasn't it, as a diabetic drug? Yes, absolutely. And we have, my practice has particularly high rates of diabetes, and we have many patients on them, and they are brilliant medicines for diabetes. We rarely see pancreatitis. If anyone's listening and worrying about that, then it's a rare side effect, very rare side effect. And we do see patients lose a lot of weight on them. And I think I read there's something like close to 1 million people in the UK on these drugs at the minute, which is... I think it's 1.5 million. Yes. But what they said about that, which I find quite interesting, it's not, and I think this is where the issue comes in. It's different if you're getting semaglutide, you've got diabetes, and you've been monitored by a doctor. I think a lot of people are going to online pharmacies and they're just not getting the right advice, or they're taking the wrong dosage, or they're going online, they don't actually know what you're buying. Yeah, so the worst is the illicit suppliers, that you don't know what you're buying. And I would strongly recommend that everyone, if you're thinking about getting these drugs privately, then you are doing it through an approved prescriber, which is either a doctor, pharmacist, or nurse practitioner for the most part. And there's new guidance that they have to follow on monitoring because there's certain BMI criteria that you have to hit. And prior there were many reports of people getting these drugs without reaching that criteria, but now there have to be safeguards in place. The prescriber must try and confirm that is actually the case if it is being a remote prescription, for example. And in terms of weight loss, I suppose in the last week here, we've seen in England it being rolled out within GP practices for people with BMI over 40 and other comorbidities. We're yet to follow that in Scotland. And, as a GP, I have reservations about adding to the GP workload myself. That's a personal view. However, these drugs, it must be said, can be transformational for some people. And that is where you need to balance. That's why I could never figure out, because it was conflicting stories all the time. And with any drug, I suppose there's pluses and minuses. When people, I can obviously definitely see it with diabetes, people are morbidly obese, and it does work. At what point do you think they should be tailing off from the medicine? Isn't that, Chris, you've always said to me, people start to train, but it's maybe only halfway through their training schedule that they realise how the important, like nutrition and being aware of what your food intake is. That's part of the education, really, of staying healthy. Yeah, it's the phrase I use to patients all the time, which Chris might not agree with, but I often tell them, exercise does not make you lose weight. Exercise makes you hungry, and you need to look at nutrition. Because often I'm talking to patients who need to lose weight for a knee replacement, say, or hip replacement, and they say they can't exercise, and I often challenge that, but also say that, look, it's not exercise. We need to look at the dietary side of things, and it is always also worth saying with that I always
try and remove any sort of self-blame or guilt that many people are carrying, because it's not their fault, it is society's fault. And now society has produced these medicines as a solution to society's problems, and that just feels a little bit wrong. Having said that, as I've said, in certain situations they can be very helpful.
Yeah, because I'm a bit concerned because of the volume of people that are actually taking these drugs, and that is obviously, let's face it, it's to get the beach body in 6 weeks, and it can be very.
That's exactly the situation where we don't want people using these drugs, and they can be most harmful. Actually,
exactly. And I think it's because it gets such a lot of celebrity endorsement as well, and people tend to be swayed by it. And yet again, you're getting conflicting stories. Someone like Sharon Osbourne. Obviously something's gone wrong there and she can no longer put on weight. So but with every drug there's pluses and minuses. What I found quite interesting is to do with nutrition and training, and you're right, working out will make you a lot fitter and stronger, but it is the nutrition that gives you the energy to be able to work out properly. I mean, I've learned, me and Chris, we talk about this all the time, about the benefits of, I think especially as you get, as an older woman, it's like getting more protein. You know, there's certain food groups I definitely eat more of now, but that knowledge only comes with when you really seriously want to improve your health. And I think if somebody was to, as part of the coaching that we talked about earlier, it wouldn't just be exercise, it'd be like nutritional advice. What do you think about that, James? Do you think that would be a good combination?
I think there needs to be massive investment beyond nutrition, beyond what we have now, which is, you know, things like the Eat Well plate, which you might remember, that sort of cartoonish sort of macronutrients plate, where I think this is an area that's very close to my heart. It's an area that I'm looking at on a personal basis, and through my other roles with the Royal College of GPs, looking at how we might improve that. This is separate from my Healthcare Improvement Scotland stuff, but that stuff is really, really important to educate healthcare professionals and educate everyone on diet from a very young age, and getting into schools, improving our knowledge, but also, you know, it's very difficult when we are absolutely swarmed with adverts and junk food and all of these things. It's very hard to resist. Because
I'm going to have to add in a bum note about food manufacturing. There's 1.5 million Britons taking this drug privately. In America, the food manufacturers have lost a massive amount of money. Now, they were making billions, but because so many people over there are taking Ozempic or Munjaro, their profits have been slashed. Now, when I looked into how they design foods, and it is a design, it's nothing, it's very, it's pure science. It's hardly, I don't think any of the food sees a vegetable, put it like that. The foods are designed to taste, smell, melt in your mouth for a specific reason. It's like what you were saying, James, about people shouldn't be beating themselves up, because these foods are designed for you to overeat them.
Exactly.
So now what's happening, apparently, allegedly, in America is the major manufacturers are realised this, and they're going to start designing foods for GLP-1 users so that it will overcome the drugs that they're taking. So they're trying to circumvent that whole, is like, though, and it's looking back to you, the whole mass medication thing. Is it the answer, or is it more an answer? Take exercise, learn about nutrition, but teach people early about that. Can't
say I'm surprised at that. I mean, this is where I've got my food. It's difficult to know which hat to put on at any one time, but this is where I've got my food writer hat on, and I suppose I'm part of a collective of food writers who lament the state of nutrition of the country, I suppose, in terms of your a lot of focus on ultra processed food, for example, and I think it's something that we just need to, personally, it's something we need to get back to basics in terms of the seasonality of our food, the access to food. You know, yes, absolutely, lots of vegetables and fruit, but prepared from scratch. But that's so difficult within the confines of, again, the society that we live, where we don't have time, where, you know, I feed my 2 daughters packeted chocolate chip brioche, you know, not the nicest things, because that is the easiest way to get through to the next day. You know, when I'm working full time and trying to do lots of other things as well, and trying to raise a young family. And it's that sort of I think the guilt around that actually just leads to more blanking it off, trying to make it tomorrow's problem. But no, it's something we need to tackle as a whole.
Yeah.
And there are many other countries that do it better. For example, if you look at Japan, if you look at Denmark, if you look at other countries that are increasing, whole food and vegetable intake and whole grain intake on a mass scale. So I think we can learn.
Yeah. Good. That sounds very positive.
Good.
That's what I like to hear. Because I think it all does come down to that. I mean, it's what you eat, it's what you do. And I think what you were saying about when you're having that discussion with your client or your patients, it's getting them involved in that discussion and empowering them to sort of say, you can do this.
Absolutely.
But giving them that sort of road to, or sort of map it out for them. Is there anything else, guys, you think we should be thinking about with regard to health and fitness that we haven't covered?
Oh, there's so much.
There's so much, I know. What do you think of the key things that people would want to hear about?
I think it is finding that, whether it's the motivation to employ or engage a PT like Chris, it is about realising something changes, something happens, that you decide that it's time for you to be more active, get fitter, eat healthier, do any of these things. And it is just, whether it's listening to this today, whether it is seeing something negative or positive, I find that positive motivators are much better than negative ones. Yeah. It's just finding that change. And hopefully if you can run with that definition, that motivation of being a happier, healthier person, then you can make other changes within your lives if you want to.
I think it's like what you were saying, Chris. There may be days when you don't want to exercise, but you always feel fabulous afterwards. Not because it's over, but because it's just those natural endorphins, and you feel much looser and lighter. But do you think there would be a trial in Scotland to say where somebody like Chris would be, would be prescribed as a solution?
Well, I'm sure many of the universities are looking at exactly that. So it would be worth looking at the academic institutions. I'm sure there are studies going on. So there's often physical activity is one of the big interventions that is looked at in various health conditions. Right. Studies across the world. So absolutely, see what's going on. Great.
Chris, any final? This is a man's podcast. Any final words to the guys? What would you like to say?
I mean, when it comes to, he just used a phrase, happy and healthy. When it comes, if you have an awareness, I think that your health is important and you want to improve it, and you know that exercise and diet, exercise and nutrition is a way to do that, just start.
Right.
And it doesn't have to be a massive plan or program. Start something. You don't need a prescription.
Right.
You can just start. And there are little things, little changes, I think, that everyone can make to their lives. They can increase the amount of steps in a day. They can go for a walk after dinner, every evening, and just say it's going to be a 20 or 30 minute walk. You can start something towards improving your health and your fitness. I think the world is full of people who are going to start tomorrow. And
with everything,
and I think it's really important. The things that we've talked about with your program, with your training, is consistency. Just know that this is a journey. You've spent however many years getting the body that you have right now. You're not going to change it in a month. It's a lifestyle. So I think one of the things that we could probably say about today this isn't about anti-medication. It's about pro-lifestyle.
Yeah, absolutely.
Pro-healthy lifestyle. I think oftentimes, because medication can be life-saving, but as an outside observer, I seem to have picked up on sometimes it's the first stop rather than the last stop. And I think that there's enough evidence to show that starting with just improving your exercise and your nutrition is probably the first way to go before going, okay, I think medication is the answer. I've had opportunities to speak in a counseling kind of a capacity with people who have self-diagnosed as having depression. And it's really, I have 3 questions to ask them. How's your diet? How's your sleep? How's your are you getting any exercise? No, all of them. They're usually all bad. And I said, what if we gave those 3 things, made those a priority, and let's see how you feel after a month, after 2 months. Because I guarantee if you improve in each of those areas, you're going to feel better. And oftentimes you discover you don't have depression, you know, or maybe clinically, you're not clinically depressed. But I think if you're eating better, if you're sleeping better, and if you're getting more
that's
exercise,
always going to help, isn't it?
yeah, you're going to feel better.
Right. Guys, this has been great. I mean, I really could talk for hours on this, but I don't have hours.
No, thank you for having us.
No, thank you. I mean, thank you very much for contributing to this, the Men Only podcast on health and fitness. Please keep tuning in, because me and Chris are going to do 2 workouts in the gym, one that's gym-based and one that's just a home workout.
Brilliant.
So you can try it, James.
I need to give it a go.
Yeah, give it a go, see what you think. But obviously, take it easy. I mean, this is just a demonstration, but it just shows you what a normal person going to a gym looks like. And I hope it doesn't put you off. But James, you're always welcome to come to the gym and work out with us.
Oh, thanks very much.
But thank you so much. I
Thank
mean, I
you.
really do appreciate you both
No,
coming.
no. Thanks for asking.
Thanks,
Yeah,
guys.
thank you for
Great.
having us. It's been great.
Keep tuning,
Cheers.
guys. Good morning. We're in Glasgow. We're going to be about to do the Men Only podcast workout, courtesy of Chris. And Chris, what we're going to do this morning in Glasgow?
Today we're going to be doing a pretty extensive complex.
Right.
All right, I'm going to start you out on the skier. You're going to burn 12 calories on the skier.
Right.
From there, you're going to go straight to 20 wall balls. After the wall balls, you're going to jump on the rower, your favorite.
Right.
You're going to do 10 calories on the rower.
Right.
You'll come straight over to your dumbbell and do 20 dumbbell snatches. You're going to do all calories on the assault bike.
Right, okay.
And we're going to do that 7 times.
Only 7 rounds.
Only 7 rounds.
Easy.
Yep.
Right, I'm going to be doing 12 calories in this.
Yep.
Should we be demonstrating how you really should do it properly?
Do you want me to demonstrate?
Yeah, on you go.
All right.
You tell me.
So with a ski, I want it to be a full body movement. You see a lot of people on here and they're pulling with their arms like this. I want you to get your whole body into it. I want you to hinge at your waist and really get some power. This way you're generating a lot more power and a lot more energy. So I want you to do that whole body. I want a full extension all the way down.
12 calories?
12 calories.
Fine. Right, let's go.
Nice. Keep up that pace. Full extension with the hands. There you go. Get much more power. Nearly there. Keep it up. Just a couple more calories.
Whoa.
There we go. Atta girl.
Right.
All right, we're moving on to the wall balls.
Right, Chris, you want to demonstrate how we...
So first I'm going to show you how not to do it, and then I'll show you how to do it,
Sure.
okay? So we'll give ourselves a little bit of space from the wall, all right? Now you'll see a lot of folks, what I'm wanting you to do is hit that lower target. The upper
Right.
target's for men, the lower target's for women. I don't want you just shooting it like a basketball, okay? I want you to get your whole body into it. It's a squat and a push. A squat and a push. All the way up, all the way down. Got it?
Got it.
All right, let's do it. Good. Squat. Nice. Very good. That's 10. Five, 4, 3, 2, done. Well done.
All that netball training came in handy.
All right, we're moving on to the rower.
So I'll just demonstrate how I do it. What you should be doing is bending in, pulling back. So about there, and you just snatch here.
Very good. Yeah, this is one piece of a kit that I might have to defer to you as the expert. Excellent pace. Well done. Got there in no time. Let's move over to our dumbbell now with the snatch. The snatch is, again, another full body power move. I want you using your legs to generate the force, bringing it straight up overhead.
Right.
Okay, it's not a clean and a press. You're throwing it straight to the ceiling and let your legs do your arms a favor, okay? Drive up like this, throwing it straight up. Okay, you can do 10 and 10, or you can alternate every one, but we're doing 20 reps. Drive down and up. Good. 2, 3. And switch. And that's 20 right there, and we're doing 8s next time. We're going up next round. We are moving on to finish this round. We're going to be on the assault bike. You're going to do this for 8 calories. Okay, you do this for 8 calories, and then you get a whopping 1 minute rest.
Now I've got to say to everybody, not my favourite bit of kit.
Yeah.
So
This is nobody's favorite bit of kit. This is an absolute killer.
Let's see if it's set up, Chris.
So once you get started, hit the green start. There we go.
So you can tell I really use this all the time.
There we go. All right, calories are at the top, and you're just going to go there till that says 8. Use your upper body and your lower body to generate the power. Very, very good. Halfway there.
Oh,
whoop, careful.
Whoa. See what I mean? Not too good with this. Just to prove it's live.
Picked right back up where you left off though.
8 calories.
One more calorie. And you're done. That is 1 round in the bag. Well done, you got through that quickly. So just 6 more times. Easy peasy.
Right, Chris, we've demonstrated like the first round of a 7-round set.
Yep.
And you've demonstrated it really, really well. Now, what's the most important thing when people are using a gym and they're using equipment? Is it obviously you've got to know how to use it properly?
You've got to know how to use the equipment properly.
Right.
Yeah, one of the worst things that you can do is come in here and use some of this stuff improperly and injure yourself.
Right.
So that's one of the reasons that it's good to work with me, because I'll be able to watch your form while you're doing it.
Yeah.
You can think you know how you're doing it, but if you're on there not watching yourself, you may be doing it completely wrong and not even know it.
Right.
So we've been working together long enough to where your form is impeccable. I'm just here as a cheerleader keeping you going. But yeah, that's probably one of the most important things, is to make sure when you come into a gym, you actually know how to use the stuff. Now, I will say most gyms, just like this one, when you join, they will offer you kind of an induction and a tour. They'll take you through, they'll show you how everything is.
People should really take that up, shouldn't
Oh,
they?
absolutely, especially if you're new to the gym. A lot of people are joining gyms and they're coming from other gyms and they've been training all their life, and that's fine.
Right.
But if you're new to the gym, some of the equipment can be a little bit intimidating. And some of it can just be confusing. You might look at something and do it completely wrong. I've seen people mount equipment or get on pieces of equipment. I'm thinking someone needs to step in here before they actually hurt themselves. So it's really good to kind of like, if you don't know, the best thing to do is ask. I think people are intimidated in gym environments, but I think you'll find that in most places people are really eager to help.
Yeah, I mean, a lot of people they've been a lot in the press about being apprehensive about going into the gym, because there's always this impression that everybody's 25 and beautiful.
Yeah, that's right.
Obviously not.
Obviously not, yeah.
So what would you say to people that is a very welcoming experience? You will get taught.
Well, you know what,
trainers there keeping an eye on you.
Absolutely, and I think that's one of the things you want to do is get a feel for it when you go in. You're probably going to check out a couple of different gyms before you join. You may pick up on certain gyms that you go, you know what, this isn't for me. There are certain gyms that really do cater to kind of bodybuilding muscle heads. You might see needles in the rubbish bins. Probably not the kind of gym that like the average everyday person who's just trying to get fit wants to go to. But a gym like this, where it's like got a very, very diverse membership, all ages, really, really friendly staff, and just the whole atmosphere and attitude here is that almost we're all like a community.
Yeah, I mean,
and that's what you're looking for. You're looking for a place where you don't go in and get intimidated or pressured, because to get off equipment, people are really polite. They're going to come in and they're going to say, how many more sets do you have on that? Would you let me know when you're done? Rather than just standing there and waiting for you to finish.
Right. So as we sort of spoke in the podcast before we came here, it's really about health as you get older as well. It's really an investment in your health.
It is.
So can you tell me, with the exercises, we talk about bone density, we talk about muscle strength. Now you can't get that from a pill.
No.
So,
no.
No, there is no shortcuts.
There's supplements that can help,
Yeah.
but you got to put the work in.
Yeah.
And yeah, as I've aged
Yeah.
and as my clientele has aged, it's become more and more it's become more and more important to me to kind of like post 40, start training for our next season of life. You know, when you're younger, you're training for the next time you're at the beach.
Right.
You're training for the next time you're in the bedroom.
Right.
But when we get older, I want to train for the next time for the next chapter of our lives, which is getting up from the floor and carrying our shopping home and being able to go up the flight of stairs without having to stop and catch our breath. So a lot of the training that I do with you is functional health and trying to get your overall body fit and strong so that you go into that next season of life ready for whatever it's going to throw at you.
I think Chris is trying to tell you that I'm not 25. We're okay with that.
There are filters for that.
Filters like that. Lots of filters. I'm going to be edited big time. But there was also something in the paper recently about exercise. Is that insurance towards your health? And they're saying how it reduces by 30%, I think, your chance of getting cancer.
Yeah.
So it really is an investment. Would you say, Chris, the best thing about exercise? I mean, there's some days I come in here and I'm thinking, do I really want to do that row?
Right.
But I do it anyway.
Yes.
It's really all about consistency, isn't
Absolutely.
it?
Yeah, you've hit the nail on the head. A lot of times we don't feel like training.
Yeah.
And one of the things that I say is fitness and conditioning and strength, it is built on the days that you don't feel like coming in, because there are going to be a lot of them.
Oh, yeah.
We're wiped out. Life, family, work, all that stuff wipes us out. This actually ideally helps, gives us the energy to get through life and family and work and all that kind of stuff. People don't realize that. Training gives you more energy.
Yes,
it doesn't take your energy. You got to take my word for it. You're going to come in, the first 2 weeks are going to be hell. You know, the first 2 weeks, you're going to think, I can't keep this up. But you're going to start seeing increased energy, better sleep. Your appetite's going to change. You're going to want to eat healthier or better foods, or at least more food, and hopefully you'll eat the healthier food. But it is going to be a transition that will lead to increased energy. But it is about consistency. It is about consistency. And I don't mean once a week. I mean coming in 2 to 3 times a week, 3 to 4 times a week, and really, really sticking with it. I think people think that they're going to train and they're going to see results immediately, and that's one of the most disappointing or discouraging things for folks, is realizing that you spent months and months and months and years getting the body that you have now. You're not going to get the body that you want in a month. Okay, it takes time. We've been training for 1.5 years together. You've completely transformed your body. You've completely transformed your conditioning and your fitness, but you've been very consistent.
I mean, I think just to give a bit of personal information, I came here because I had a bad break, and it was actually my cousin who was a doctor, so I said, get a bone density scan. I'm thinking, hold on a minute here, not that old. I want to start sort of training and getting strong, and I knew I could do it through exercise. But you mentioned, Chris, obviously the importance of food. Now, you hear a lot of people saying they go to the gym, they work out, they're very hungry afterwards. But you can't out-train a bad diet.
Cannot out-train a bad diet.
So you have to actually do things in tandem where, say, if I did a heavy workout with you or a heavy session in the gym, I'd go and immediately have a protein breakfast.
Right.
So it's also getting that knowledge with food and what food's good for you.
Yeah.
Which
and if there's so much information out there, you may have it. You can get it from me and from your PT. You can probably get it online. Find out how to get your proper total daily energy expenditure breakdown of how many calories you should be eating, your macros broken down. We can do that through a formula. You can do that again probably through finding it online. But what I've found over doing this overall, like for as long as I've been doing it, actually the people that are just mindful of what they're eating, they'll see a dramatic improvement. Yes, we can break down the calories perfectly. Yes, we can break down the macros perfectly. But if the people who just think about what they're eating and think, I need to be eating this and not that, maybe the portion control and all that stuff comes later. But if they just start realizing, I need to be eating more protein with each meal, I need to be reducing the amount of empty carbs and alcohol that I'm drinking. And once they just start thinking about eating healthy, they start eating healthy. It becomes a habit. Then you can start figuring out, how many grams of this do I eat? How many, what size portion of sweet potatoes do I have? Or something like that. But that's another thing, is like we always talk about protein and we always talk about calories. I think people, when they come in and they start working out, they think, I've got to stop eating. I've got to get rid of all my calories.
That's wrong, because you get no energy.
Sometimes you need to eat more calories. Depending on how you're training, you just need to eat the right calories. And that's part of the whole fun of the equation of figuring out, how do I put my fitness training and my nutrition and my sleep and my hydration and all that stuff together to get the fitness and body that I want and need.
Right, I'm now going to make a confession to Chris. Now, I'm not a stranger to a Tunnocks wafer or an Empire biscuits. It's the truth, or even a wee glass of white Rioja, quite like that. But I think that is it, Chris. You can't, I think if you go down this journey, wanting to be healthy and fitter, it's not wearing the hair shirt. You can still have the glass of wine,
Absolutely.
you can still have the treat.
Absolutely.
It's been able to balance it out. So I'd really encourage anybody, if I can do it, anybody can do it.
Yep.
But now I'm thinking I'm trying to delay it as long as I can before I have to do all these reps. So now I'm going to be doing what's...
Normally you don't get...
Normally I don't get a breath.
Yeah.
So we're going to do 6 reps. You don't need to do it as quickly as I do it. It's taken me a long time to get this fit, but it gives you an idea of what we do. And we're also going to do another workout after this, which you can do at home. So Chris will be just going to start again, because he's never going to let me stop this length.
No, I think it's time to hit stop,
Right, okay.
cut, and let's get back to it.
Right, okay. Right, Chris, we've just finished the first workout, which was gym based.
Yeah.
Now we're going to do a home workout, just so that anybody out there that's still a bit intimidated about going to the gym, you can start to warm up at home. Chris, what we're going to do?
Well, one of the best resistance pieces of kit that we have is our body.
Yeah.
We're carrying around weight, okay? So we can use that weight to our advantage when we're training.
Right.
So there are all kinds of different exercises that we can do that are body weight focused, like press-ups, squats, lunges. We can incorporate jumps. We can use chairs or things in the house to do dips for our arms. There's all kinds of things that we can do just with our body weight to start to get fit.
Right.
So what I'm going to do today is I'm going to put you through, it's only 3 moves.
Right.
This is something that anyone can do in their lounge.
Right.
Clear out the coffee table, clear out a little bit of space. You don't need a lot of room.
Move the wine.
Okay, move, yep, lock up the wine. We are going to do, now here's the intimidating part. This is what it sounds intimidating. 100 press-ups, 100 squats, 100 leg raises.
Right.
Okay? But we're going to do those in increments of 5.
Right.
So you're going to do 20 rounds of 5, 5, and 5.
Right.
That's always manageable.
Right.
Okay? If I were to say right now drop and give me 100 press-ups, you would be like, I've
seen the film.
Yeah, that's right. You'd probably want to strangle me. But if I say do 5, 5, and 5, catch your breath, and then do it again.
Yeah.
All right? So let's do that. So we're going to go 5 press-ups, 5 body squats. We'll do them together. Should we do them together?
Right, sure. Right,
okay. So we're going to get into our plank position, and we're going to do 5 press-ups.
Right.
1, 2, 3, down. 1, 2, 3, 4, 5. Since we're down, let's just flip around and do our leg raises. Why not? We're already on the ground. Okay. On our backs. And 1, 2, 3, 4, and 5. And let's get up and do our squats.
Oops. Get this in. Up to this again.
Prayer hands. And 1, 2, 3, 4, 5. And there we go.
Easy.
19 more times.
Right, Chris, we've done the gym workout, we've done the home workout. What else could you possibly say to the people out there to encourage them to get into the gym?
Well, whether it's get into the gym or whether it's get started training, it's just get started.
Right.
I mean, get to it. The world is full of folks who are going to start tomorrow,
Right.
who are going to procrastinate and put it off until tomorrow to start. And I just say, get started today. Don't hesitate.
Right.
The longer you wait, the less likely you are to do it. So let's just get started.
And there's no age limit. It can be any age. You should do it.
Any age at all. In fact, I would encourage, I think there's people who think, I've waited too long, I'm too out of shape, I've never played sports, I've never done anything fit. No. I think it's more important for those folks to start. I think post 40 is the most important time of our lives to start being serious about our fitness.
Right.
When we're younger, yes, we get all the reaction, all the response, we get all the progress, we make all the gains, and we've got the testosterone and the bodies to respond to training.
Right.
And at that time, we're training for the next time that we're going to the beach. We're training for the next holiday. But right now, we need to be training for the next season of our life.
Right.
For whatever life is going to throw at us, the stronger we are, the better we're going to be, the more fit and better we're going to be to face it.
So basically, it's just a case of let's just take that first step.
Take that first step.
Be
Don't
consistent.
hesitate. Be consistent.
Enjoy it.
Absolutely enjoy
Absolutely
it.
enjoy it because it's not torture.
Pick a kind of training that you're going to enjoy. Don't pick a kind of training that you're going to hate because you won't stick with it.
Yeah. So is it really basically finding some sort of training that you're really going to stick to? It could be rowing, it could be running, it could be
one of the
anything.
things about getting started is that you're going to discover things that you didn't know were there,
Right.
and you may discover that you love it.
Yeah.
You might discover that you love powerlifting.
Yeah.
You might discover that you love rowing.
Right.
You didn't know, and all I want to do is get out there and row 13,000 meters a day.
Absolutely.
Right?
Right. Thanks, Chris. To all the men out there, I really think you should be thinking about your health. I know you don't, but this is an easy way for you to sort of get into the groove and get fit and healthy. I would definitely recommend you, as you've seen Chris's t-shirt here, go to the menonly.org.uk website, join my newsletter, find out what's happening and what men are wanting to talk about. And I think you'll find it interesting, and we're obviously going to have the workout on the website as well for you to tune into at any time. I'd also like to, as someone who has worked behind a camera, and I don't think people who work behind a camera get sufficient, recognition. I'd really like to thank Kevin for shooting this today on a Sunday in Glasgow, which is for one sunny, because he's about to shoot his first film, which we will be keeping an eye on, and especially me, because I do love a rom-com. So Kevin, thank you so much for squeezing me in as another good men, and I think when you go to the website you will see a gallery called A Few Good Men, and it's all the men that's helped me on this journey so far, and I hope to add to that. So if you want to help me, you know where I am. Thanks a lot, guys. I really appreciate it. As you will know by now, at the end of each podcast I show one of Jez's paintings. This particular painting Jez titled I Love My Smartphone and My Smartphone Loves Me. Jez and I went out for coffee almost every day to our local cafe to each talk about what we had done that day and basically anything and everything which caught our attention. In the papers and the news, really anything. It was a great way to relax, shake off the workday and have a wee chat before heading home, feeling so much better. We did, however, indulge in a bit of people watching. We gradually noticed a change. People bought their coffee, couples and families, but not a word was spoken as they were all glued to their smartphones. Our conclusion, your smartphone definitely does not love you. And this, I'm sure, inspired Jez to paint this image. Only tech billionaires are the winners here. Ignore the algorithms. Why not switch off your phone when you next sit outside to have a coffee? If it's a sunny day, enjoy the warmth, the blue sky, a chat with a friend or partner. Literally smell the coffee and savour the day. Do not, as recent reports predicted, waste 25 years of your life looking at a digital screen. Mental health is as important as physical. Give yourself a break. Life's short, don't waste it.